Today I'm reacting to the Edge injury at Backlash 2020. Stay tuned to find out more. So today I'm talking about the most recent Edge injury that occurred as part of the Backlash 2020 event. Although Edge recently made his return to professional wrestling after an extended layoff due to injuries to his neck, his triumph may have been cut short as a result of an injury suffered while wrestling Randy Orton at Backlash. So let's talk about what happened, how it happened, what this means for Edge's return, and whether this will put an end to his miracle comeback after 9 years away from the ring. For more information on that injury and his amazing return to the WWE, be sure to check out my video on that after you're done watching this video right here. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. Backlash 2020 was a WWE pay-per-view event that was produced for the Raw and SmackDown divisions. It was broadcast on June 14th of 2020. Although the event was aired live, the match that involved Edge was pre-recorded on June 7th of 2020. This match, the main event, including Edge and Randy Orton, was billed as the greatest wrestling match ever. It was part of the ongoing feud between Edge and Orton, stemming from Edge's return earlier this year. The match was to be a traditional singles match between the two former tag team partners. Although it was said not to have lived up to its title and pre-match hype, the match was entertaining and included a number of throwback moves employed by each of the wrestlers. Classic moves used in the match included Kurt Angle's Olympic Slam, Triple H's Pedigree, the Rock Bottom, and the Kill Switch. After a number of false near finishes, Orton resorted to trickery, no straight up traditional wrestling there, with a low blow to gain the advantage over Edge before performing a punt kick on Edge, yes, the dude with the neck injury, which gave Orton the win in the match. Not only did Edge lose the match, it appears that he was injured during the match as well. It is not clear when during the match that he was injured, but he was noted to have suffered a bruise on the back of his right arm at the end of the match while he laid in the middle of the ring. After the match, word came from backstage that he had suffered a serious injury to his right arm. Pictures circulated on the internet of the bruise on his arm. Although he had not yet been officially diagnosed or even examined in the hospital, there was speculation that he had suffered a torn triceps in his right arm. So what exactly is a triceps tear anyway? The triceps is the major muscle that is positioned between your shoulder and the elbow on the back of your upper arm. It is made up of 3 different heads or parts, each with its own bony attachment. These heads include the long head, the medial head, and the lateral head, each with its own bony origin on the back of the humerus, the upper arm bone, or the glenoid, the shoulder cup. The 3 muscle bellies come together to attach at a common insertion point on the olecranon, the proximal part of the ulna. The attachment blends with the fascia of the muscles of the forearm. Although each of these heads has a slightly different function, the main action of the triceps is extension of the forearm at the level of the elbow. In other words, the triceps is basically the muscle that straightens your elbow. A triceps tear is a rare traumatic injury that is typically seen in middle-aged men. Generally, it occurs for only 1% of all tendon injuries. It usually occurs during competitive weightlifting or when bodybuilding, but it is also common in football players as well. It occurs twice as frequently in men than it does in women, and it usually affects males between the ages of 30 to 50 years old. Edge is, after all, 47 years old. There are a number of factors that can increase the likelihood of this injury that include systemic illness such as rheumatoid arthritis or diabetes, use of certain types of antibiotics, chronic olecranon bursitis or infection of the tissue between the skin and the bone of the elbow, local steroid injection, and anabolic steroid use. So how does the triceps tear? The usual mechanism of injury is forceful eccentric contraction of the triceps, or a foosh. An eccentric contraction describes a muscle contraction where the triceps is contracting at the same time that it is getting longer in length. A foosh is the acronym for the injury mechanism that involves a fall on an outstretched hand. This is a common mechanism for injuries of the wrist. Usually, the rupture of the tricep occurs at the bony insertion of either the medial or the lateral heads, but occasionally it can also occur in the muscle belly or at the musculotendinous junction between the muscle and the tendon. Usually, patients report having suffered a painful pop in the back of the arm or the elbow at the time of injury. On examination, they usually present with pain and swelling in the arm, with bruising over the posterior aspect of the elbow. If the tear is significant, there may also be a palpable defect present, and this just means that there is a hole that you can stick your finger into. Functionally, patients with this injury will demonstrate difficulty with extending the elbow against resistance, and this may even be completely impossible if the tear is complete. This is demonstrated with the modified Thompson squeeze test, where squeezing the triceps muscle when the patient is laying prone or on their belly results in an inability to extend the elbow against gravity. Since there is not a formal classification system for triceps tears, we can typically describe them by their characteristics, which include their degree of tearing, their location, and the involvement of the lateral expansion of the insertion into the muscles of the forearm. Tears can be either complete, partial, or intact. Their location may include the belly, the musculotendinous junction, the tendinous insertion, or even an avulsion off the bone of the olecranon. So how will they determine if Edge has suffered a true triceps tear? Usually, imaging is used to confirm the diagnosis of the injury. Plain X-ray may demonstrate a flake sign on the lateral view, which represents a sliver of bone pulled off the olecranon by the triceps muscle. However, MRI is better for diagnosis and can help to determine the location and the severity of the injury. So how will this injury be treated? Some triceps tendon injuries can be treated non-operatively if they are only partial tears and the patient retains the ability to straighten their arm against gravity or light resistance. However, this approach is usually reserved for low-demand patients in poor health. For Edge, if the tear is complete or partial but involves more than 50% of the tendon, he will likely be treated with primary surgical repair. And this just means that he will have the repair performed as soon as is possible. Surgical repair is the treatment of choice for tendinous ruptures in athletes. And yes, Edge is an athlete. Usually, a repair is performed through a posterior incision or an incision on the back of the arm. The repair technique used depends on the location of the tear. Tears at the junction between the muscle and the tendon can be repaired by a tendon lengthening procedure called a VY advancement. Sometimes augmentation with a tendon from the foot called the plantaris may also be required. Tears at the tendinous insertion can be repaired with sutures attached to anchors in the bone or through tunnels through the olecranon. Avulsion injuries can be repaired using either a tension band or a screw washer construct. The repaired tendon will be immobilized in a splint or cast for 4 to 6 weeks. Tendon healing is likely to occur around 6 weeks, but range of motion can be initiated after 4 weeks. Resisted elbow extension and weight training are avoided for approximately 4 to 6 months. If there are no complications, Edge may return to training after that time. However, he must be cautious of complications such as recurrent elbow pain, olecranon bursitis, flexion contracture, and re-freaking rupture of the tendon. In a study of military patients with this injury who underwent primary repair, 84% of patients were able to return to full military duties within 2 years of their injury, but nearly half had occasional elbow pain. So, what does this mean for Edge? Once this injury is surgically repaired, Edge will face a period of approximately 4 to 6 months before he can begin training, and another period of time over which he will need to get back into performing condition. In total, we are likely looking at 8 to 9 months at least, if not more. Reportedly, Edge is contracted to perform in only 5 events per year, so his absence will not be terribly problematic for the WWE. Consequently, he may be gone for up to a year before he returns to the ring. But at least this absence, if not permanent, will be shorter than his last absence from professional wrestling. Let me know in the comments how long you think he'll be out following this injury and whether you think that he might retire from the industry altogether. Now, let's look at my favorite comments from the previous videos. If you want to be part of the team that helps with the preparation of videos and the selection of topics, you can support what I do by joining me on my Patreon page, where you'll have access to additional content that is not available here on YouTube, and you'll be able to interact with me more closely. If you enjoy podcasts and you haven't done so already, be sure to subscribe to my new podcast channel. The link will be in the description down below. And if you're looking for exercises and workouts, or you want more information on injury prevention, be sure to check us out on our sister channel here on YouTube, Human 2.0. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just like a flesh wound.